Hi, I'm Lisa Ruck, Director of the Center for Predictive Medicine at the Duke Clinical Research Institute and Director of the Duke AI Health Data Science Fellowship Program. Today I'm talking with Wendy Webster, Chief of Clinical Operations for the Duke Department of Surgery, and Dr. Dan Buckland, who's an assistant professor with both the Department of Surgery and the Pratt School of Engineering. They're going to tell us about their experience working on an innovative data science project designed to provide real-world impact in the clinic. This project is just one of many underway with the help of the Duke AI Health Data Science Fellowship Program, a 2-year training opportunity for students with a strong quantitative background and a serious interest in an intensive training experience at the intersection of applied data science and healthcare. The fellowship program has dual aims of bringing together quantitative and clinical teams to derive actionable clinical insights while preparing the health data science workforce of the future. So Wendy and Dan, thank you so much for being with us today. Wendy, I'd like to start by asking if you could set the stage for us. Tell us about the Duke Surgery Laboratory for Transformative Administration, and when you first engaged with the fellowship program on behalf of the LTA, what kinds of problems were you interested in tackling and why?
I help lead our LTA with our chair in the Department of Surgery, and it really just kind of puts data science focused investigators side by side with kind of health system data analysts, really to look at, let's test this hypothesis about quality or cost or operational efficiency. And it includes individuals on that team from like Dr. Buckland, Pratt School of Engineering, beside data scientists with management engineers from performance services or other faculty members. We have residents that participate in the lab as well. And it really allows us to real-time, real-world test these questions that we have to understand, are we looking at the right data elements, and are we starting to use a solution to a problem that makes sense, or create a solution to a problem? Our ORs are full. There's no additional ORs to be had. We need to run more efficiently. And so we started to really delve into how do we schedule, how can we make it more efficient with that piece? And we partnered with a company to really create an electronic repository to create real-time access to data. We did a great job. We increased efficiency. But to go to the next level, we needed really more compute. We needed an AI health fellow. And it really allowed us to partner with a fellow who was bringing in the different machine learning and AI techniques so that we could start to understand and better predict what is the clinical variable that's going to impact that length of stay for the patient. Or how can we better sequence our cases throughout the day so that we don't have that bottleneck and we have better patient care? Dr. Buckland and his team really brought that quant aspect to our lab and have helped us really go much further than we ever thought we could.
As a clinical faculty, or as I work in the emergency room as one of the physicians, it's really great to see that the AI fellows are embedded within a clinical department. And so they are kind of immersed and embedded into the way we talk about patients and flow. And that's their primary role, is to sit among the clinicians or among the operations folks and understand the jargon we're using, instead of having to explain to a person who's just come in for that problem as to, this is why it's important to me that a patient doesn't sit in the emergency room for very long while waiting for a surgery, that they can go, that knowing, like, kind of at a assumption level, why it's important that the patient not wait in the place that's not appropriate for them, which it can be explained, but the fact that they can move between projects within a clinical context and bring those assumptions with them, make them a lot kind of quicker on the draw at saying, oh, I see why this is a problem in this environment. Let's bring these tools and these skills from this other problem and this data to kind of answer that problem together. Supervise Connor and Hamed, two fellows working on what we thought were two very separate projects. Hamed was working on the efficiency of the ORs, how to get the people to the right place, how to get patients to the right operating room, and knowing how many resources they need in the operating room. So that's an efficient use of the hospital resources. where Connor was working more with me in the emergency room in determining what patients need what resources in the emergency room. And what was great that they had this community of fellows that they were working within is that they realized that the output of Connor's modeling of the resource being used was the input of Hamed's project, right? So people moved from the emergency room to the operating room. And so they were able to work out within this AI fellowship, and by fellowship, it turns into an actual fellowship of people, right? Instead of the traditional academic term of fellowship of a further training. So they have this fellowship of we're working with the same patients from the same electronic medical record. Can I now make these two projects overlap and deliver the output of the emergency room project or the emergency department project into the input of the OR efficiency one? So not all patients come from the emergency room into the operating room, but the unplanned ones do. And so having the emergency room patients, emergency department patients be closer to the planned elective patients in terms of how their data looks has tremendous potential to improve efficiency overall.
And Dan, can you talk a little bit about the impact you're seeing on operations?
So in the emergency department project, the goal of that project is to both at an individual patient level and at a emergency department kind of department level, the amount of resources a patient will need in the near future, so we can kind of balance load different resource allocations. And then at a department level, we could then inform the rest of the hospital as to here's how many patients are going to be needing beds in the hospital over the next couple hours, which like as a weather forecast, knowing what kind of umbrella you needed to bring ahead of time is very helpful for a hospital that is planning on what kind of operations they're going to do the next couple of days. In the change in resource balance that was happening with the COVID-19 pandemic, a lot of stuff had to get turned off and turned back on. And so knowing what the patient load from the emergency department is, even just a couple hours ahead of time, helps us kind of balance that load between the different places in the hospital that need to happen as all these, as patient volume comes back up to the pre-pandemic levels. As a stakeholder in how the resource allocation is being done, it gives us a more objective kind of entry into that discussion. And so it helps in the discussions of how many patients should we allow to come from other hospitals around the region, because we know how many are sitting in the front door waiting to come in. And then when the operating rooms are like, well, how many trauma patients or how many of the surgical patients are going to need surgery in the next however long, we can start to inform that discussion with objective numbers.
What are your thoughts about how the fellowship program or having a fellowship in place help you with your ability to nimbly respond to some of the demands related to COVID? And can you talk about lessons learned from that for the future?
There was a tremendous amount of data that was always available, but underutilized into how the operating rooms and the hospital resources were being utilized, right? And it was done on kind of like rules of thumb and the way we've been doing it for years. And just because that's how Duke and most large hospital systems operate.
So the nice part about the AI fellows work is they don't see it in just a narrow framework. They get to see that entire continuum of that patient flow from the emergency department up through the OR to the floor and then being discharged with that piece.
It's been really fun to watch the fellows, Hamed and Connor and the other fellows as well, develop in their fluency around the therapeutic area, and also their fluency in translating the data science aspects, thinking carefully and critically about the research question, and then how that translates into an appropriate analysis, and then how you interpret the results and think about the strengths and limitations of the approach you're taking.
I think that's been very helpful or kind of changed my practice a little is that in both Hamed and Connor's work as AI fellows, there is this understanding or this dogma in medical school and in residency that going and seeing the patient is what informs you as to what's supposed to happen next. What Hamed and the data Hamed and Connor have kind of come out was that in my mind, I'm like, this is what a sick patient looks like. This is what a sick patient needs. But I wasn't able to kind of break down what sick meant, right? What a resource intensive patient, what the objective things I was pulling from that patient encounter were that were determining what I was doing next. And so both in Connor and Hamed's work, that was what was coming out was, here are the pieces of the data that correspond to your clinical gestalt, right? It wasn't replacing clinical gestalt, but it was augmenting it. It's not making clinical decisions for me, but it's helping me separate the wheat from the chaff in terms of this person needs a clinical decision made before the others in the waiting room and stuff like that.
So how does the AI Health Data Science Fellowship approach offer a different lens on the kind of problems you're trying to solve?
I think that what the data science aspect really brings is kind of what I described before, kind of you're stepping back and looking at all the data that you have instead of just a very narrow band that, you know, we could probably all do from graduate school. That they are really taking it to another level by saying we have a lot of data available. Let's take that big data and then let's show you what's the most important to really pay attention to focus on with that piece. And it does exactly what Dr. Buckland described, allows us to get in and intervene earlier. You know, we are all time poor. And so being able to be more efficient with our time to focus on those things that are one, the most relevant, the AI fellow helps us see that in a very quick fashion around the data.
There's just a great dynamic here with a lot of different sources of learning and exchanging information and helping the fellows take their work to the next level. One of the big focuses of the fellowship program is communication. So we have the fellows constantly presenting to each other and to us and learning to develop their skill in presenting their data in a way that non-data scientists can understand. It's something we all find pretty challenging to do, but they're really focused on it. And we, you know, as I mentioned, we're constantly poking at it, and they're really growing and developing those skills very nicely.
When I'm looking for a project that would be most beneficial to bring in the AI Health Fellows or the AI Health community, it would be the kind of clinical question where I have massive amounts of data that I don't know what to do with, right? But I have access to it. I know that the answer's in there because I make decisions based on these patients all the time in my clinical work. I don't necessarily know why I'm making these decisions, but it seems to be working. And I want to know what I can do better. And so what the AI Health Fellows are great at is kind of figuring out why I'm doing what I'm doing and then what can be optimized about it. And so those would be the kind of questions I think would be the best to bring in the AI Fellows to address in terms of when you ask yourself, well, how could they help me?